Hi everyone, welcome back to my channel. I hope you're all doing all right. Oh god, it's been ages since I've been on camera. I'm really nervous about it. So I'm back with a bit of a hybrid video. So this is kind of a mixture between a update video for people that watch my channel on the regular, so it might be a bit chatty, and it's also to share my experience of having well, it was actually 3 procedures in one really, which is what's called, which was ovary removal, fallopian tube removal as well, and fibroid removal. So it's actually called unilateral Salpingo Oophorectomy. That's the removal of the tube in the ovary. And Myomectomy, which was the removal of a fibroid, and yeah, actually had some endometriosis removed as well, which I didn't realise I had, and some biopsies as well. So the biopsy was of the peritoneum and the omental, which is like a layer of fat which is underneath your abdominal organs to check for cancer. Yeah, so it's a bit of a mouthful. I had the surgery done 5 weeks ago now. It's been quite a big roller coaster of recovery, hard work to recover. I'm still not right yet. I'm still recovering, and I've had my results as well, and I'm very happy to say that it was benign. The tumours that I had were benign, but they weren't sure what they were beforehand. So it's been a very scary time kind of waiting, although I have kind of just managed to not think about it. That was my way of coping with it, was to like not think about it unless it happened. Sorry, I can't sit twisted like this. I'm still at mum and dad's. I've been staying there for the last 5 weeks. I've actually done a bit of a recovery vlog, so if you want to see that, sort of how it's affected me, what I've been up to as I've been recovering, the stuff I've used to distract me, just go and check that out. I look really rough on it. Yeah, so I thought I'd share my experience with you really. So my results, first and foremost, I actually had a dermoid cyst which was on the left ovary. So I lost my left ovary and my left fallopian tube, and the dermoid is quite a common thing. It's something that, as I've said before, it grows, you're often born with it, and it gets bigger and bigger and doesn't go away, and it can be filled with things like teeth and hair and stuff like that, because it's from where cells don't close properly when you're in the womb. So you're kind of born with it, and then throughout your life it gets bigger, and so that's quite common. I had one of those, and then I also had like a multilocular, which is multi-pocketed cyst, and that was on the inside of my fallopian tube, kind of coming from the ovary, and that was called a cystadenofibroma, and that one is quite a rare thing to have. It's actually benign, but it mimics a malignant tumour. It can look like it's something malignant. I'm gonna have to turn around because I still can't hold it like this. How am I gonna sit? I don't know. Yeah, so it took 5 weeks for the results to come back, and I think that's why, because it can be quite difficult to distinguish and diagnose. So I guess that's why my results took quite a while, rather than the sort of 10 days that they said prior to the operation. So yeah, I'll share with you a bit about what I went through now. Obviously I'm very grateful. I'm very, very grateful that it wasn't anything really bad. it's been a year now of waiting around. The whole experience started in December of not just gone, but the one before that, before the Christmas. And I'm sorry, I'm sitting slightly side faced. I can't twist. And I had a incidental finding of it because I had lots of urinary tract infections, and these were quite devastating because they were all the time. And I had yet another one, and then this lady doctor saw me and decided to send me for some scans. So she sent me for what's called a transvaginal ultrasound scan, which sounds like a, flashy holiday, but it's not, and yeah, so they scan you externally with an ultrasound on your belly and internally. It's nothing too bad if you ever get referred for one of these. It's uncomfortable, and it took about 20-25 minutes for me, but it's not what you'd call painful. It's just more of a sort of makes you feel a bit squeamish in my case. And they found them then. Weren't sure what they were. They then ordered blood tests and a second scan as well. I think I had about 4 scans over the period of a year, 3 or 4 scans leading up to this operation. And my first blood test showed an increase in LDH levels, which is lactose dehydrogenase, which in certain germ cell tumours that can cause this LDH elevation. So that threw up some concern as to what it could be, and so then they did a further blood test, which luckily it had come back down again, so it kind of decreased the alarm that they were feeling, but they did more scans over a period of time to see if they were growing, and they did grow. They told me it had gone from something like 5 centimetres to 7 in just a few months, and the other one had grown as well, the dermoid had grown as well, but this one in the unusual one was growing faster. So I went to see a consultant gynecologist, because up until that point I'd only seen like GPs and the lady who did the scanning, what they call them, radiologist. So I was sent to a consultant gynecologist. That wasn't a great experience because he opened up by saying, "How many children do you have?" In quite a presumptuous manner, and I had to say none. And then he said, "Oh, the treatment for this is hysterectomy. What do you want to do?" basically, and put me on the spot. And I was like, "Whoa, what?" And it was all very matter of fact, and I found that very upsetting, actually, the way that was sort of put to me. And I said, "Look, I don't want that. I don't want whatever I decide to do. I don't want that unnecessarily. I don't want a menopause straight away, because if they take both ovaries away, you go into an immediate surgical menopause. And I didn't want my options taken away like that." And when he said that, like, the feeling that could happen, because I didn't know for a start off if I could get away with just having part of things removed, or if it would be necessary to have everything removed, and the anger I felt and the upset at that was immense. I've never felt anger like it, actually, and I quite shocked myself as to how upset I actually found that. I guess it must... Sorry. I guess it must be something... to do with being a woman. You know, and you get a lot of comments from people that assume because of your age that, you know, oh, just get rid of it all, like it's some sort of treat, you know, because you don't have to cope with periods and things. And it was like, oh yeah, just get rid of it. I had so many comments like that. So yeah, you know, not everybody feels that way, you know, and I don't think that's talked about enough, that not everybody sees that in a blasé fashion just because they're a certain age. Anyway, I eventually got to see a consultant at the hospital, at City Hospital Nottingham this was. She was very nice, and yeah, they basically, after a series of scans and bloods, you know, they ascertained that it was growing, that it needed to come out, and I had a word with her about, you know, how I felt, and she said that, you know, it should be safe enough for me to have just that area removed rather than the whole lot. But obviously, you know, if it was anything sinister, there's always the chance that you have to have more removed. It just depends, really. Yeah, so she had examinations and stuff, and yeah, by the time I was put on the waiting list, it was like a 5-month wait, and I actually had it done in December at QMC in Nottingham. So about the actual day itself, so I was put automatically into like it's like a day surgery unit. Although I was told, Mum was told at one point I would be kept in, but I wasn't. And yeah, so I went in. They show you through to like a ward, which with beds in it. Well, first you're in a waiting room, then you showed to like a ward with beds in it, and they very kindly, they did me. I think I was second in the queue that day, because I have quite bad problems with like low blood sugar feelings. If I don't eat regularly, I get very shaky. So they didn't want to keep me too long without eating. I was sat on the bed, and then they sent like the anaesthetist through and the surgeons through, and they sort of spoke to me about what they were going to do. And, you know, the doctor explained to me that they weren't sure what this particular thing was in my tube. And, you know, the lady said to me it could be borderline. This lady registrar, you know, she said you really need to get this out. And yeah, the theatre team, they wheeled me down there. The porter was so hilarious. He was brilliant. So yeah, I want to say thank you to him, because he was so cool. Like he just made me laugh all the way down to theatre. He was definitely exactly the type of person that you need in that kind of job. Yeah, just so kind and funny. So yeah, thank you to him. And the theatre staff, they were beyond incredible. Beyond incredible. The anaesthetist said he was like Harry Potter to try to make me laugh. Yeah, he was. I actually, when I came round, I felt better than I had when I went to sleep, because I was so nervous. And you know, I was obviously very concerned about having that done because of various like neurological problems that I've had in the past. So I've had a lot of problems with like adrenaline and anxiety, and that affecting the way my muscles work, and the messages getting through, almost like functional disorder. And I've got a heart condition as well, so like I was very worried about having this anaesthetic and what it might do as regards my nervous system. But he must have, like, he just got me through that, and I can't thank him enough for that. You know, like they're just amazing how they can do all this stuff to you. Like I just can't get over it. I can't get over how they can do all this stuff and you just don't know that it's even happening. it's crazy. And I remember waking up just like I'd been to sleep, and there were two blokes like standing over me, and I was just remember thinking, oh yeah, I forgot I was having that done, you know. Yeah, and then yeah, they came and told me that they'd removed this big fibroid that was causing quite a lot of pain. So like I experienced before this surgery, a lot of urinary tract infections all the time, and yeah, they could be quite devastating, because they made any sort of relationship quite impossible, if you know what I'm saying. And yeah, they just get you down as well. And I would always like be needing to wee, and if I was out, you know, I couldn't hang on very long, and I had to go quite often and make provisions for that. And I've already noticed that I don't seem to have that now, the frequency anymore, which is of needing to go to the loo, which is good. Yeah, so that's something, you know, because the cyst can actually press on the bladder, and so can the fibroid as well, and that could cause pain as well in certain situations. And yeah, so I was sent home that day. I think they said the surgery was going to take about 2 hours. I'm not entirely sure how long it took, because I was too out of it to look at the clock, but I do know I was back at, they put me out at 10:20 in the morning. I don't even remember like counting backwards. I remember him giving me like a painkiller in this hand, and then not being able to breathe and kind of panicking and my heart banging, and then it kind of went off. And then I remember him getting another syringe out to put in, and I don't remember a thing. I must have literally gone straight out at that point. So yeah, that's all I remember of the operation itself. And I was back on the ward at like 4:30, so I know I was still asleep at 3 because my mum rang up and I was in recovery still asleep. So I was gone for a fair while. Yeah, then the recovery, so I was sent home. The recovery's been more rough than I expected in terms of like how much it has affected mobility and for how long. I kind of didn't really expect that. So as you probably would have seen in the vlog, like getting up out of bed, I was just like a beetle. Couldn't get out of bed. It would take me ages to sort of shuffle and pull myself out of bed, because you lose all like the strength in your abdominal muscles. So that for me was one of the worst things. And I think also the swelling, because it was a laparoscopy, which is keyhole surgery. So the incisions I had were minimal. So they there's 3 incisions. There's one in the belly button, and then also slightly 2 centimeters down from that, because it was quite big, so they had to like cut a bigger hole, and then 2 small incisions either side above my hips on my abdomen. So one is for the camera, and one is for the what's the other one for? The air, because they blow your belly up with carbon dioxide so that they can get in there and do what they need to do. And then the belly button is where they remove things from. They actually get a plastic bag, and they put the cyst in a bag and burst it in the bag, and that stops any infection or cancer cells potentially getting into your body when they rupture the cyst and spreading it. And it also means that they can get the cyst out of a smaller hole, so a smaller incision is needed. So it's very clever. But yeah, so it was, because they did it laparoscopically, that involves like a long probe, that they use to, like, I presume burn things away. I don't know. But that causes quite a bit of, like, bruising and swelling, because although it's a smaller incision, you know, they're waving this sort of stick around. And yeah, so up here, actually, just under my breasts was like the worst. You know, that really swelled, and it felt like a tight band, and still does sometimes, especially when lying down now. So it was very uncomfortable to sit, and for many weeks, like, I didn't know where to put myself. I couldn't sit comfortably, because it was pulling, and it was pressure, and I felt like I couldn't really breathe properly. So that was actually the upper part, which is also where they put the laparoscope to take the biopsies as well, was worse in a way than lower down where they'd done stuff. Yeah, because obviously, like, where they took the biopsies from is under the rib cage, so it's higher up. And they do that because if you have, like, an ovarian cancer tumour or a borderline one, you can get what are called seedlings, so remaining, I don't know whether it's remaining tissue or I think it's cells from that original tumour that can either just sit on that membrane or under the ribs, or they can take root in there and spread, like, rarely, if it's borderline. So that's why they do biopsies of that area. So yeah, I didn't know that about the borderline stuff. I wasn't really told that. So that's worth knowing and considering. So yeah, that's why they did that. So yeah, I've kind of had, it's been 5 weeks now, so I've had 5 weeks of really not doing very much at all. Definitely the first week or two are the worst. You know, it really was a case of just getting out of bed, walking to the toilet, walking to the armchair, sitting in that for a couple of hours and going back to bed again, and yeah, just being propped up and that sort of thing, watching a bit of telly, and then just kind of gradually trying to move more. So getting in the shower was very difficult, because obviously you have to cock your leg over the bath. So I couldn't do that for a while. I couldn't really do anything like make a sandwich for 2 or 3 weeks. Yeah, say 3 weeks, because every time I sort of brought my hands forward like this, it would pull on my stomach and hurt, and you know, like, you can't really lift anything either, which I still am not lifting anything much at all. But yeah, I'd say about the 4-week mark was when I started to see more of a drastic improvement, and when you get improvement, it can be quite quick over a series of days. Then you might plateau for a bit and then get a bit more. I mean, I've read a lot of reports where people have said that they've actually got better in, 10 days to 2 weeks, and they're back at full speed then. I haven't been like that, and whether that's due to, like, my other health problems. I've got ME as well, so, like, the rest of my muscles in my body aren't perhaps so strong as someone else's, to like compensate. But I don't know, everybody's different, aren't they, really? So yeah, at the 5-week mark, I can now get out of bed slightly easier. It's still more difficult. It's still the worst thing about it, I think, is getting out of bed, because it pulls. At night time as well, I've had a lot of sleepless nights because I could only sleep in one particular position, otherwise it was pulling and really uncomfortable. And, like, I'm sleeping on my back as well, so yeah, and I slept elevated on my back. I still have high pillows now. So yeah, but I'm now able to, like, make sandwiches. I've been doing short walks up the road it's took me 5 weeks to get to the end of my street, but at least I've done it now. Yeah, lots of colouring. I've done some knitting as well. Knitted our doggy a jumper, so it's a right mess, but at least it's something useful. Keep him warm, so I definitely recommend that you have something really gentle to just distract you from thinking about things. I think that really helps. So yeah, you know, if as regard that's the update as regards if you're watching this, you know, for reasons that you're having the same thing done. You know, don't take my recovery as this is how yours is going to be, because I think most people or some people are a lot faster. So you may well be too. And yeah, just distract yourself those initial few days to just make sure that you, because obviously for blood clots and stuff you can't like not move at all, and that can be quite tough, you know. Just obviously you've got to try and get out to go to the loo and stuff, but just be patient with yourself, and I think, you know, after a few weeks you just do things really, really gradually, and then that saves you having to do anything drastic and scary, because you've done it really gradually. You know, you can't push yourself to do more than you actually can, you know. I don't know if any of that has been useful, but that's been my experience so far. I'm still not driving, I'm still not lifting, you know. I wouldn't lift up a full kettle of water now, and I wouldn't lift up, like, you know, a heavy pint of milk, a heavy bottle of milk or something like that, just because I'm not comfortable with doing that, and I think you have to use your instincts really. But yeah, the other thing that happened is Jay actually got COVID over Christmas. He got it like 3 days. He came down with it 3 days after I'd had the surgery, and bless him, spent Christmas alone, which was just awful. And obviously, like, we did our best to try and have a good day. Like, I was here and he was at my house. So this is my parents' place. This is my old childhood bedroom behind me. And yeah, we used FaceTime a lot so that we could talk, and we delivered his dinner. Dad delivered his dinner, Mum cooked it. So yeah, but it was just awful because you know, we're going to open the presents after Christmas now, have this special day sort of soon, where we all open our presents, but they were all stranded at the house as well under the tree. So all of this frantic prep that we'd done before I went into hospital to make sure everything was bought and wrapped and ready was kind of all a bit fruitless really. Yeah, so he was very poorly with it. He had like really bad temperature, really bad cough, chesty. He, you know, it was quite frightening at one point. And he was positive. He had it for 3 weeks. He was positive for 3 weeks. So he must have had a really good old dose of it. I think it must have been this new variant that is more severe than Omicron, because definitely by the description of it, it was not like Omicron. So yeah, I was very lucky not to catch it, because he'd been round here watching telly the night before he came down with it. So we were all thinking, oh my God, you know, are we going to get it as well? We were very lucky that we didn't, because that would have been horrendous. But yeah, it's been a funny old time. So I'm still here being looked after. There's certain things I can't manage to do, and also have to be very careful that Midge doesn't. He's a bit of a trampler, and at home he sleeps in bed and tramples on me so I need to be sleeping here really, and he also tramples on me during the day, so I need somebody there to kind of get him off if he does. He's been so gentle though, bless him. He does, you know, he is careful and he does get next to me and go to sleep, but it's just if he gets a bit carried away, I need somebody to like pull him off, and then there's just stuff that I can't always bend all the way down to get off the floor or whatever. So yeah, it's just more comfortable at the moment to just stay here for now, and the doggy is going back and forth, keeping us both company, so that's nice. He kept Jay company over Christmas, thank goodness we had him, and he's been with him during his times off work as well, so yeah, his days off he's always with him, so that's nice. So yeah, it was a bit of a Christmas, a bit of a washout really. I mean, we had a nice day, we still had a nice dinner, some nice telly and everything, but yeah, it was not the Christmas that we had planned it to be. It lost somewhat of its magic, but as long as everybody's okay at the end of the day, that is it really, isn't it? I think as regards like hormones and stuff, I shouldn't get a menopause because I've still got one ovary left, so I have to obviously wait and see if my hormones get affected by it. The things I've noticed since are that I think I get more upset about things than normal at the moment, so things that bother me more, and I don't think people talk enough about the mental side of it. You know, it before I had it done, it was all quite blasé about, oh yeah, just get rid of it all, you know, but being told that, you know, it does affect you mentally as a woman. And even me, like, I'm so lucky I only lost half of my reproductive system, you know. I'm lucky I've still got to keep the uterus and the other side, the ovary and everything, but I still, like, I'm very swollen still, well, not very swollen, but I'm still quite swollen. I feel like I look different to how I normally look, and hopefully I think it takes like 3 months for all that swelling to go down, but it's like, you know, there shouldn't be this, but there's like a stigma, I feel, attached to menopausal issues and that sort of thing, and hysterectomies, and to me, like, it signals, obviously I'm at the end of youth, like I'm in my 40s, but it sort of like signals that to me, even though it happens to young people as well, and I've still got an ovary. I'm not in menopause, and I shouldn't be either for a good few years, but it's just it's treading in that territory, and that shouldn't be anything to be ashamed of at all. It's just that I feel like sometimes society can make women feel a bit like that, like after a certain age, like, you know, there's all this, isn't there, about you get past 40 and you start to feel invisible, and I do think that there's something in that. And I'm not saying that, like, young people have a hard time as well. Like, I know when I was young, like, for example, at work, you know, you might go to college, uni, school, whatever, and then you go into work, and then it's like, oh, well, what do you know? You don't know anything, you know. So there's prejudice and there's rough times for everybody, like, whatever age group you're in. But I do feel that when you get to a certain point, an age in life, like as a woman, it's kind of like people start talking in the past tense about what you could have been and what you could have done, rather than what you could do and what you are. It feels like you don't fit in. What was I saying? yeah, you feel a bit like you don't fit in, and you feel a bit like self-deprecation is expected all the time and laughed at all the time. And it makes you feel like a bit of having anything like that done, I don't know, just it shouldn't. But it makes you feel like a failure. It's like a shame attached to it. I don't know why. Because, like, I'm grateful, it was nothing bad. Like, I'm so grateful, it was that, and nothing bad. It's just, I think that, I don't know, like, as you go through life, like, certain experiences stay with you, as regards your self-esteem and your confidence and that sort of thing. And then it's like, when you have to have something like this, I almost feel like it confirms it. It confirms that your self-esteem it makes it worse. It makes those negative ideas in your head about yourself worse. And I don't think there's enough spoken about that, really. Because I've never been like, I've got to rush into having kids. I must have kids. Because I think you've got to be in the right position, the right life position for them. Not, for me personally. But I've still got that innate sense of having failed in that part of life and others, because things weren't as I expected. So yeah, sorry to get emotional, but it might help someone else address how they're feeling. Yeah, all the compliments stop. When you get to a certain age, all the compliments seem to stop. I mean, Jay gives me compliments, but society at large, in general, I think it's like, just get on with it. You just get on with stuff, and you're too old for that. Do you know what I mean? But yeah, it's a lot of mixed feelings. But I mean, I'm jumping for joy that it's not anything bad, and I think it's like, a second chance, really. I mean, it's not, to sound dramatic, because I haven't been through what some people have been through, where they've had to fight cancer, but it's a wake-up call, and I think I do need to get to the hairdressers and just maybe just pop to the salon, which I've never ever been to, and just say, can you help me a bit? I'm not going to have any nips and tucks, don't worry. Not there's anything wrong with that at all, but just to get out of the makeup rut, and just to see if I can feel like I look more like I used to look before a load of shit went down. Do you know what I mean? yeah, just feel more like I used to feel, really. Might go to Boots and make myself a little appointment for one of them free makeup consultations or something like that. I think that might be quite a nice thing to do when recovered a bit, something to look forward to. You know, I think you've got to give yourself something to look forward to. Yeah, and we'll get back down the river again. You know, we'll get back to walking by the river and sitting and having McD's. Not that that's going to help, is it? And I'd like to lose a bit of timber if I can. Not that I'm overweight, but I'm more out of shape for me personally. So I'd just like to tone up a little bit. So I'm going to do a few things. I've actually got one of those LED light skin treatment things that you can use on your face. I'm going to start using that as well. Maybe do a bit of face yoga. Got one of those. Got a DVD actually that I used to use years ago. That I bought off Ideal World, I think it was. I can't remember the lady's name. She's got like long black hair. But yeah, the 10-minute facelift, I think it was called. So I might do that. Just like a few little treats to just make myself feel a little bit more positive. I mean, Jay's been great. He's always been on the end of the line to talk to, you know. Midge and my mum and dad have been amazing, you know, doing meals and everything. So, yeah. But yeah, getting back to that, you know, I hope if you have to go through all this, try not to worry too much about the surgery itself, you know, because you won't know anything about it. And then just be prepared that everybody's different, I would say, and it can take a bit of a while to get mobile, but not necessarily, you know, you don't have to expect that. Just try and keep relaxed. And yeah, I hope everybody, which I should have said this at the very beginning, Happy New Year to everybody. I hope you had a good Christmas. I hope it was less eventful. Yeah, I hope that 2024 brings you lots of love and luck. And yeah, I don't know what else to say really. I'm not great at speaking, even though I've gone on for 44 minutes now. But everybody's probably asleep by now. But yeah, I hope this video has been useful anyway, and thank you for following the channel. Thank you for watching if you've got this far. If you've enjoyed this video, please leave us a like and a subscribe. This is primarily a vlog channel. So yeah, if you wanna check out any of our vlogs, just day-to-day stuff, please do. And yeah, I guess I'll see you in the next one. Thanks for watching. Bye.